Question 1. Quality control measures reveal that a certified clinical specialist in sports physical therapy, SCS, has documented an analysis of an athlete's pitching mechanics, focusing primarily on the sagittal plane motion of the shoulder and elbow. The documentation notes the degree of flexion/extension and rotation, but does not explicitly describe or analyze the athlete's frontal or transverse plane movements during the pitching delivery. Considering the regulatory framework and guidelines for the SCS credential, which of the following approaches to analyzing joint kinematics during sports activities is most aligned with professional standards and regulatory expectations? Option A. Focus the kinematic analysis on the most commonly injured joints and planes of motion relevant to the specific sport, as identified through general sports medicine literature. Option B. Rely on subjective observation and palpation to infer joint motion in all planes, without the need for explicit documentation of each plane's kinematics. Option C. Conduct a comprehensive analysis of joint kinematics across the sagittal, frontal, and transverse planes, documenting observed or measured deviations from normative patterns during the specific sports activity. Option D. Prioritize the analysis of sagittal plane motion, as it represents the primary plane of movement for most athletic actions, and supplement with qualitative descriptions of other planes if significant abnormalities are noted. The correct answer is C. Conduct a comprehensive analysis of joint kinematics across the sagittal, frontal, and transverse planes, documenting observed or measured deviations from normative patterns during the specific sports activity. Explanation. This scenario is professionally challenging because it requires the sports physical therapist to balance the immediate need for effective patient care with the overarching regulatory requirements for documentation and professional conduct. The therapist must accurately assess and document joint kinematics during a specific sports activity, ensuring the analysis is both clinically sound and compliant with the standards set forth by the Certified Clinical Specialist in Sports Physical Therapy, SCS, credentialing body, and relevant state practice acts. The challenge lies in selecting an approach that is not only technically proficient in analyzing motion, but also ethically and legally defensible. The correct approach involves a systematic and objective analysis of joint kinematics across all three cardinal planes, sagittal, frontal, transverse, during the identified sports activity, utilizing appropriate observational techniques and potentially biomechanical tools if available and indicated. This approach is correct because it directly addresses the core competency of joint kinematics analysis as expected of an SCS specialist. It aligns with the ethical obligation to provide evidence-based and comprehensive care, ensuring that all planes of motion are considered for a complete understanding of the athlete's movement patterns. Furthermore, it supports accurate and thorough documentation, which is a fundamental regulatory requirement for patient care and professional accountability. Adherence to these principles ensures that the therapist's assessment is robust, defensible, and contributes to effective treatment planning and injury prevention strategies, all within the scope of practice and professional standards. An incorrect approach that relies solely on subjective observation without systematic plane analysis fails to meet the comprehensive assessment standards expected of an SCS specialist. This approach is ethically deficient, as it may lead to incomplete or inaccurate conclusions about the athlete's biomechanics, potentially impacting treatment efficacy and increasing the risk of overlooking critical movement impairments. Regulatory failure occurs because such an assessment would likely not meet the documentation standards for a thorough clinical evaluation. Another incorrect approach that focuses only on the sagittal plane, neglecting the frontal and transverse planes, is also professionally unacceptable. This selective analysis is a significant regulatory and ethical failure. It demonstrates a lack of understanding or application of complete biomechanical principles, which is contrary to the advanced knowledge expected of a specialist. Such an incomplete assessment can lead to misdiagnosis or inadequate treatment, violating the duty of care owed to the patient, and failing to uphold the rigorous standards of the SCS credential. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the specific clinical question or task, e.g., analyzing joint kinematics during a specific sports activity. 2. Recall and apply the foundational principles of biomechanics and the specific competencies required for the SCS credential, including understanding motion in all three planes. 3. Consider the available resources and the patient's specific needs and the demands of the sport. 4. Select an assessment methodology that is comprehensive, objective, and allows for detailed analysis across all relevant planes of motion. 5. Ensure that the chosen method facilitates accurate and thorough documentation that meets regulatory and professional standards. 6. Critically evaluate the findings to inform clinical reasoning and treatment planning, always prioritizing patient safety and optimal outcomes. Question 2. Comparative studies suggest that the optimal muscle length for maximal force production occurs at or near the muscle's resting length, with force output decreasing at lengths significantly shorter or longer than this. Considering this principle, an SCS-certified sports physical therapist is evaluating an elite sprinter experiencing hamstring tightness that is impacting their stride length and power. Which of the following approaches best reflects the application of this knowledge within the scope of sports physical therapy practice? Option A. Prioritize aggressive manual therapy techniques to lengthen the hamstrings to their absolute maximal physiological limit, believing this will unlock the greatest potential for force production. Option B. Focus solely on eccentric strengthening exercises for the hamstrings, assuming that increased eccentric strength will compensate for any suboptimal muscle length during the sprint cycle. Option C. Implement a progressive stretching program to increase hamstring flexibility, aiming to achieve a muscle length that research indicates is associated with peak force generation, while simultaneously assessing and addressing any associated neuromuscular control deficits. Option D. Recommend a complete cessation of all hamstring-focused exercises until the athlete's hamstring flexibility returns to a pre-injury baseline, regardless of current functional capacity. The correct answer is C. Implement a progressive stretching program to increase hamstring flexibility, aiming to achieve a muscle length that research indicates is associated with peak force generation, while simultaneously assessing and addressing any associated neuromuscular control deficits. Explanation: this scenario is professionally challenging because it requires a sports physical therapist to balance evidence-based practice with the unique physiological demands and performance goals of an elite athlete. The therapist must consider not only the theoretical optimal muscle length for force production, but also how this applies to the athlete's specific sport, position, and current functional status, while adhering to the ethical and professional standards of the Certified Clinical Specialist in Sports Physical Therapy, SCS. The SCS credential signifies a commitment to advanced practice, which includes the judicious application of scientific principles to optimize athlete outcomes. The correct approach involves a comprehensive assessment that integrates the understanding of the muscle-length-tension relationship with the athlete's sport-specific demands and functional limitations. This means evaluating the athlete's current muscle lengths, their ability to generate force at various lengths, and how these factors impact their performance and injury risk within their sport. The therapist then uses this information to design an individualized intervention program that aims to optimize muscle function, which may involve stretching, strengthening, or neuromuscular re-education, all within the scope of practice defined by the SCS and relevant professional guidelines. This approach aligns with the SCS core competencies of evidence-based practice, clinical reasoning, and patient-centered care, ensuring interventions are safe, effective, and tailored to the individual. An incorrect approach would be to solely focus on achieving a specific theoretical muscle length without considering the athlete's functional capacity or sport demands. For instance, aggressively stretching a muscle to its absolute maximal length, even if it theoretically falls within a range of high force production, could compromise dynamic stability, increase the risk of injury during explosive movements, or negatively impact the athlete's sport-specific skills. This fails to uphold the principle of individualized care and may not align with the evidence-based practice expected of an SCS. Another incorrect approach would be to ignore the muscle-length-tension relationship entirely and focus only on general strength training, neglecting the potential for improved force production and efficiency that can be gained by optimizing muscle length. This would represent a failure to apply advanced knowledge and skills expected of a specialist. The professional decision-making process for similar situations should involve a systematic evaluation. First, understanding the underlying physiological principles, like the muscle-length-tension relationship. Second, assessing the individual patient's current status, including their sport, functional limitations, and goals. Third, critically appraising the available evidence to guide intervention selection. And finally, developing an individualized, evidence-based treatment plan that prioritizes safety, efficacy, and the athlete's return to sport. This iterative process ensures that theoretical knowledge is translated into practical, effective clinical care. Question 3. Cost-benefit analysis shows that optimizing cycling biomechanics through precise pedal stroke analysis, seat height adjustment, and handlebar position modification can significantly enhance athletic performance and reduce injury risk. But the implementation of these interventions presents a challenge in determining the most effective and safest course of action for a competitive cyclist experiencing chronic anterior knee pain and a perceived plateau in power output. Which of the following approaches best aligns with the principles of evidence-based practice and ethical sports physical therapy for an SCS credentialed specialist? Option A. Conduct a comprehensive biomechanical assessment of the cyclist's pedal stroke, including cadence, power application, and foot-ground reaction forces, while simultaneously evaluating seat height and handlebar position in relation to the cyclist's kinetic chain and subjective pain report, to develop a multifaceted intervention plan that may include equipment adjustments, targeted strengthening, and motor control retraining. Option B. Advise the cyclist to experiment with various saddle heights and handlebar positions independently, based on popular cycling forums and anecdotal advice from other athletes, to find what feels best, and to return only if the pain or performance issues persist after several weeks of self-directed adjustments. Option C. Immediately recommend a significant reduction in seat height and a more upright handlebar position, as these are common adjustments for cyclists experiencing knee pain and seeking to improve comfort, without a detailed analysis of the individual's specific pedal stroke mechanics or power output. Option D. Focus exclusively on addressing the anterior knee pain through isolated quadriceps strengthening exercises, assuming that the pain is the sole limiting factor for performance and that biomechanical adjustments to the bike are secondary. The correct answer is A. Conduct a comprehensive biomechanical assessment of the cyclist's pedal stroke, including cadence, power application, and foot-ground reaction forces, while simultaneously evaluating seat height and handlebar position in relation to the cyclist's kinetic chain and subjective pain report, to develop a multifaceted intervention plan that may include equipment adjustments, targeted strengthening, and motor control retraining. Explanation. The scenario presents a common challenge for sports physical therapists, balancing the desire for optimal athletic performance with the imperative to prevent injury, all within the scope of practice and ethical guidelines. The Certified Clinical Specialist in Sports Physical Therapy, SCS, credential signifies a commitment to evidence-based practice and patient-centered care, which are paramount in this context. The challenge lies in interpreting complex biomechanical data and translating it into actionable, individualized interventions that respect the athlete's goals and physical capabilities, while adhering to professional standards. The correct approach involves a comprehensive assessment of the cyclist's pedal stroke, seat height, and handlebar position, integrating subjective feedback with objective biomechanical analysis. This approach prioritizes a holistic understanding of the athlete's movement patterns, potential compensations, and the interplay between equipment fit and physiological load. The justification for this approach is rooted in the SCS's commitment to evidence-based practice and the ethical obligation to provide safe and effective care. By systematically evaluating all relevant factors, the therapist can identify the root causes of performance limitations or injury risk, leading to targeted and personalized interventions. This aligns with the principle of beneficence, ensuring the athlete's well-being and optimal functioning. Furthermore, it upholds the principle of non-maleficence by actively seeking to prevent harm through proactive injury risk reduction. An incorrect approach would be to focus solely on one aspect of the biomechanical assessment, such as only adjusting seat height without considering handlebar position or the athlete's specific pedal stroke mechanics. This narrow focus risks overlooking critical contributing factors to performance deficits or injury. Ethically, this approach fails to provide comprehensive care and may lead to suboptimal outcomes or the development of new issues due to unaddressed biomechanical inefficiencies. Another incorrect approach would be to implement changes based on anecdotal evidence or popular trends in cycling, without a thorough biomechanical assessment and consideration of the individual athlete's physiology and injury history. This disregards the evidence-based practice mandate of the SCS and could lead to inappropriate interventions, potentially causing harm or exacerbating existing problems, thus violating the principle of non-maleficence. A third incorrect approach would be to make drastic equipment adjustments without proper athlete education or gradual acclimatization, potentially leading to discomfort, new pain, or a decline in performance due to the athlete's inability to adapt. This demonstrates a lack of consideration for the athlete's experience and the practicalities of implementing biomechanical changes, which is an ethical failing in patient-centered care. Professional decision-making in such situations requires a systematic, evidence-based process. This involves 1. Thorough subjective history-taking, including the athlete's goals, pain, and perceived limitations. 2. Objective biomechanical assessment, utilizing appropriate tools and techniques to analyze pedal stroke, posture, and joint kinematics. 3. Integration of findings to identify biomechanical inefficiencies and potential injury risk factors. 4. Collaborative goal setting with the athlete. 5. Development of a personalized intervention plan that may include equipment adjustments, targeted exercise prescription, and motor control retraining. And 6. Ongoing reassessment and modification of the plan based on the athlete's response. Question 4. Investigation of a collegiate soccer player who has recently completed rehabilitation for a grade Roman II hamstring strain. The athlete reports feeling stronger, but expresses apprehension about cutting and accelerating during practice. The physical therapist, holding SCS certification, needs to objectively assess the athlete's readiness for return to sport. Considering the demands of soccer, which of the following assessment strategies would be most appropriate to guide the return to sport decision? Option A. Conduct the STAR excursion balance test to assess static and dynamic postural stability in multiple planes of motion. Option B. Utilize a combination of the Y balance test and single leg hop for distance to evaluate dynamic balance, unilateral strength, and power relevant to soccer's demands. Option C. Perform a series of isometric hamstring strength tests to quantify muscle force production. Option D. Administer the functional movement screen, FMS, to assess fundamental movement patterns and identify any residual asymmetries. The correct answer is D. Administer the functional movement screen, FMS, to assess fundamental movement patterns and identify any residual asymmetries. Explanation. This scenario presents a common challenge in sports physical therapy, selecting the most appropriate functional assessment tool for a specific athlete and injury profile. The Certified Clinical Specialist in Sports Physical Therapy, SCS, designation implies a high level of expertise and adherence to professional standards, which are governed by the American Physical Therapy Association, APTA, standards of practice, and the relevant state practice acts. The challenge lies in moving beyond a superficial understanding of these tests to a nuanced application based on the athlete's current functional deficits, sport demands, and the specific goals of the assessment. The correct approach involves a comprehensive evaluation that integrates the athlete's history, sport-specific demands, and the identified limitations. The chosen functional movement screen should directly address the suspected impairments and provide objective data to guide rehabilitation and return to sport decisions. This aligns with the APTA Code of Ethics, which emphasizes providing competent care and making evidence-based decisions. Specifically, Principle 4A states that physical therapists shall provide the most effective and efficient care possible within the constraints of available resources. Selecting a test that directly measures the athlete's functional limitations and sport-specific demands ensures efficient and effective care. Furthermore, Principle 1C mandates that physical therapists shall provide care that respects the inherent dignity and individuality of each person. This means tailoring the assessment to the individual athlete, not applying a one-size-fits-all approach. An incorrect approach would be to solely rely on a single, widely recognized test like the Functional Movement Screen, FMS, without considering its limitations or the specific needs of the athlete. While the FMS is a valuable tool for identifying fundamental movement patterns, it may not adequately capture the dynamic, sport-specific demands, or the nuanced balance deficits relevant to a high-level athlete returning to a cutting and pivoting sport. This could lead to an incomplete assessment and potentially premature return to sport, violating the ethical obligation to ensure patient safety and optimal outcomes. Another incorrect approach would be to administer a battery of tests without a clear rationale for each, leading to an inefficient and potentially overwhelming assessment that doesn't effectively inform clinical decision-making. This fails to meet the standard of providing efficient care. Finally, choosing a test based on personal preference or familiarity rather than its scientific validity and applicability to the athlete's situation is a failure of professional judgment and adherence to evidence-based practice, a core tenet of the SCS credential. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understand the athlete's injury, sport, and functional goals. Second, review the available evidence and psychometric properties of various functional assessment tools. Third, select the tools that best align with the athlete's specific needs and the assessment objectives. Fourth, administer the chosen tests with proper technique and interpret the results within the context of the athlete's overall presentation. Finally, use the assessment data to inform a personalized and evidence-based rehabilitation and return-to-sport plan. Question 5. Benchmark analysis indicates a collegiate basketball player presents with a history of recurrent ankle sprains and reports difficulty with rapid deceleration and change of direction maneuvers during games. The physical therapist, an SCS credentialed specialist, needs to determine the most effective approach to address these functional deficits and optimize the athlete's return to competitive play. Which of the following approaches best reflects an evidence-based and sport-specific strategy? Option A. Implement a progressive strengthening program for the peroneals and tibialis anterior, focusing on isolated isometric and isotonic exercises, and incorporate general plyometric drills to improve lower extremity power. Option B. Conduct a detailed biomechanical analysis of the athlete's deceleration and cutting mechanics during simulated basketball movements, identifying specific kinetic chain dysfunctions, and then designing a rehabilitation program that directly targets these deficits with sport-specific drills and progressive loading. Option C. Prescribe a series of balance exercises on unstable surfaces and recommend a general conditioning program that includes running and jumping activities to improve overall fitness. Option D. Focus primarily on reducing the athlete's reported pain levels through manual therapy techniques and modalities, with a secondary emphasis on basic range of motion exercises for the ankle. The correct answer is A. Implement a progressive strengthening program for the peroneals and tibialis anterior, focusing on isolated isometric and isotonic exercises, and incorporate general plyometric drills to improve lower extremity power. Explanation: this scenario is professionally challenging because it requires the sports physical therapist to integrate advanced biomechanical principles with the specific demands of a sport and the individual athlete's presentation, all while adhering to the scope of practice and ethical guidelines for a certified clinical specialist in sports physical therapy, SCS. The pressure to return an athlete to play quickly, coupled with the complexity of identifying the root cause of a functional deficit, necessitates a systematic and evidence-based approach. The correct approach involves a comprehensive biomechanical analysis that directly correlates observed movement dysfunctions with the specific demands of the athlete's sport. This means not just identifying a faulty movement pattern, but understanding how that pattern impacts performance and injury risk within the context of their sport's unique actions, e.g., pitching mechanics in baseball, cutting in soccer. This aligns with the SCS credential's emphasis on advanced clinical reasoning and the application of specialized knowledge to optimize athletic performance and prevent injury. Regulatory frameworks for physical therapy, including those governing SCS specialists, mandate practice within one scope, adherence to evidence-based practice, and a commitment to patient-centered care, all of which are embodied in this approach. An incorrect approach would be to solely focus on isolated muscle strength or flexibility deficits without considering their functional integration into sport-specific movements. This fails to address the biomechanical chain and the kinetic sequencing critical for efficient and safe athletic performance. Ethically, this approach risks providing an incomplete or ineffective rehabilitation program, potentially leading to recurrent injury or suboptimal performance, which falls short of the standard of care expected of an SCS. Another incorrect approach would be to rely on generic exercise protocols that are not tailored to the specific biomechanical demands of the athlete's sport. While general conditioning is important, it does not address the nuanced, high-velocity, and multiplanar movements characteristic of competitive sports. This approach neglects the core principles of sport-specific rehabilitation and biomechanics, potentially leaving the athlete vulnerable to sports-related injuries. Regulatory guidelines emphasize the importance of individualized treatment plans based on a thorough assessment of the patient's specific needs and functional goals, which this generic approach fails to meet. A further incorrect approach would be to prioritize the athlete's subjective report of pain over objective biomechanical findings when making return-to-play decisions. While pain is a crucial indicator, an SCS specialist must also integrate objective biomechanical data to ensure the athlete has regained the necessary functional capacity to safely participate in their sport. Ignoring objective biomechanical deficits, even in the absence of significant pain, can lead to a premature return to play and increased risk of re-injury. This is a failure to uphold the professional responsibility to ensure the athlete is physically prepared for the demands of their sport, a key tenet of sports physical therapy practice. The professional decision-making process for similar situations should involve a systematic evaluation that begins with understanding the sport's biomechanical demands. This is followed by a thorough athlete assessment, including observation of sport-specific movements, identification of kinetic chain dysfunctions, and correlation of these findings with potential injury mechanisms. Treatment should then be designed to address these biomechanical deficits through sport-specific drills and progressive loading, with objective measures used to guide return-to-play decisions. Question 6. System analysis indicates that a collegiate soccer player presents with chronic patellofemoral pain, impacting their ability to perform cutting maneuvers and jump. The physical therapist is considering several standardized outcome measures to assess the player's progress. Which of the following approaches best reflects a regulatory compliant and ethically sound strategy for selecting and interpreting these measures? Option A. Choose the Knee Outcome Survey Activities of Daily Living Scale, CAS-ADL, and the Lishom Knee Score, and interpret the results based on the therapist's clinical experience without consulting established McKidd or the patient-specific sport demands. Option B. Administer the DASH questionnaire, as it is a widely recognized upper extremity outcome measure, and assume that improvements in this score will indirectly reflect overall functional gains. Option C. Utilize the Victorian Institute of Sport Assessment Achilles (VISA) questionnaire, as it is a validated measure for tendon-related pain, and focus solely on the numerical score to determine treatment effectiveness. Option D. Select the Lower Extremity Functional Scale (LEFS) and the International Knee Documentation Committee Subjective Knee Form (ICKF) to capture general lower extremity function and knee-specific symptoms, and interpret changes in scores in relation to the player's reported improvement in sport-specific activities and established McKidd for these measures. The correct answer is D. Select the Lower Extremity Functional Scale (LEFS) and the International Knee Documentation Committee Subjective Knee Form (ICKF) to capture general lower extremity function and knee-specific symptoms, and interpret changes in scores in relation to the player's reported improvement in sport-specific activities and established McKidd for these measures. Explanation. The scenario presents a common challenge in sports physical therapy, selecting and interpreting outcome measures for a patient with a complex, multifactorial presentation. The professional challenge lies in moving beyond a superficial application of a single tool to a nuanced understanding of how different measures capture distinct aspects of function and impact, and how these findings align with the patient's goals and the demands of their sport. This requires a deep understanding of the psychometric properties of various instruments and their relevance to the specific clinical context, ensuring that the chosen measures are not only valid and reliable, but also meaningful to the patient and clinically actionable. The correct approach involves a systematic and evidence-based selection of outcome measures that are validated for the specific condition and population, and that address the patient's reported limitations and functional goals. This includes considering measures that capture pain, function, and sport-specific demands. The interpretation of these measures must be done in the context of the patient's individual presentation, their sports requirements, and established minimal clinically important differences, McKidd, where available. This aligns with the ethical imperative to provide patient-centered care, grounded in evidence, and to ensure that interventions are guided by objective and meaningful data. Regulatory frameworks for physical therapy, such as those overseen by the American Physical Therapy Association, APTA, and state licensing boards, emphasize the use of evidence-based practice and the accurate documentation of patient progress, which necessitates the judicious selection and interpretation of outcome measures. An incorrect approach would be to solely rely on a single, broad outcome measure without considering its specific limitations or the patient's unique needs. For instance, using only a general functional scale without incorporating a measure, specifically addressing the biomechanical demands of the patient's sport or the nuances of their pain experience would lead to an incomplete picture of their functional status and progress. This failure to adequately assess the patient's condition and track progress using appropriate tools could be seen as a deviation from the standard of care and a potential violation of professional practice guidelines that mandate comprehensive evaluation. Another incorrect approach would be to select measures based on ease of administration or familiarity, without verifying their psychometric properties or relevance to the patient's specific condition and goals. This could lead to the collection of data that is not valid or reliable, rendering the interpretation of results questionable and potentially misguiding treatment decisions. Such a practice would undermine the principles of evidence-based practice and could lead to suboptimal patient outcomes, which is contrary to the ethical obligations of a physical therapist. The professional decision-making process in this scenario should involve 1. Thoroughly understanding the patient's subjective report of pain, functional limitations, and sport-specific demands. 2. Identifying potential outcome measures that are validated for the patient's condition and sport. 3. Critically evaluating the psychometric properties, validity, reliability, responsiveness of candidate measures. 4. Selecting a battery of measures that collectively provide a comprehensive assessment of the patient's status, addressing pain, function, and sport-specific performance. 5. Interpreting the results in conjunction with the patient's goals and the MCID for each measure. 6. Using this comprehensive data to inform and modify the treatment plan. Question 7. The review process indicates that during an on-field assessment of a collegiate soccer player who sustained a direct blow to the head during a game, the physical therapist observed immediate disorientation and reported dizziness. Which of the following immediate management strategies best reflects a process-optimized approach to this situation, prioritizing athlete safety and adherence to established protocols? Option A. Immediately remove the athlete from play, initiate a sideline concussion assessment protocol, and arrange for physician evaluation prior to any consideration of return to play. Option B. Focus on palpating for bony tenderness around the head and neck, and if none is found, clear the athlete to return to play after a brief rest. Option C. Instruct the athlete to sit on the bench, monitor for symptom resolution, and allow return to play if symptoms subside within 15 minutes. Option D. Advise the athlete to drink water and rest, and if symptoms persist, suggest they see a doctor after the game. Correct answer is C. Instruct the athlete to sit on the bench, monitor for symptom resolution, and allow return to play if symptoms subside within 15 minutes. Explanation. This scenario is professionally challenging because the sport's physical therapist must make rapid, critical decisions under pressure with limited information, directly impacting the athlete's immediate safety and long-term prognosis. The on-field environment presents unique challenges, including distractions, the presence of coaches and spectators, and the need to balance the desire for the athlete to return to play with the imperative of preventing further harm. Careful judgment is required to accurately assess the severity of an injury and determine the appropriate immediate management, which can range from continued participation to emergency referral. The correct approach involves a systematic on-field evaluation that prioritizes the athlete's safety and adheres to established emergency action protocols. This includes recognizing red flags indicative of serious injury, performing a focused assessment to rule out life-threatening conditions, and making an informed decision about immediate management based on objective findings and the mechanism of injury. This approach is justified by the ethical obligation to provide competent care, the legal duty to act within the scope of practice, and the regulatory framework governing sports physical therapy, which emphasizes patient safety and evidence-based practice. Specifically, the American Physical Therapy Association, APTA, Standards of Practice, and the Code of Ethics for Physical Therapists guide the physical therapist in prioritizing patient well-being and making sound clinical judgments. The Certified Clinical Specialist in Sports Physical Therapy, SCS, credential signifies advanced knowledge and skills in this area, including the ability to effectively triage and manage acute athletic injuries. An incorrect approach would be to prioritize the athlete's desire to return to play over a thorough assessment, potentially leading to a misdiagnosis or delayed appropriate care. This fails to uphold the ethical principle of beneficence and non-maleficence, as it risks causing further harm. Another incorrect approach is to rely solely on subjective reports from the athlete or coach without performing objective on-field assessments, which is a deviation from best practice and regulatory expectations for a comprehensive evaluation. This neglects the professional responsibility to gather objective data to inform clinical decision-making. Furthermore, failing to recognize and appropriately manage signs of serious injury, such as neurological deficits or significant bleeding, and instead opting for a conservative, non-urgent management plan, constitutes a failure to adhere to emergency protocols and could have severe consequences, violating the duty of care. Professional decision-making in similar situations should involve a structured approach. First, ensure scene safety. Second, establish the mechanism of injury. Third, perform a rapid systematic on-field assessment including vital signs if indicated and neurological screening. Fourth, consider differential diagnoses based on the assessment. Fifth, determine the appropriate disposition, e.g. return to play, sideline management, referral to physician, emergency medical services activation. And sixth, document the findings and plan. This systematic process, guided by professional standards and ethical principles, ensures that the athlete's best interests are paramount. Question 8. Quality control measures reveal that a collegiate swimmer presents with insidious onset of bilateral shoulder pain, described as a deep ache that is worse at night and not directly related to swimming technique. The swimmer also reports intermittent fatigue and a slight, unexplained weight loss over the past 2 months. The physical therapist notes mild bilateral supraspinatus weakness and tenderness, but no significant limitations in range of motion. Which of the following approaches best reflects the physical therapist's responsibility in this scenario? Option A. Focus solely on improving swimming biomechanics and providing modalities for pain relief, as the primary complaint is shoulder pain related to their sport. Option B. Initiate a progressive strengthening program for the rotator cuff muscles and provide manual therapy for the supraspinatus, assuming the symptoms are a typical presentation of overuse injury. Option C. Conduct a comprehensive differential diagnosis, including screening for systemic conditions and red flags, and refer to a physician for further medical evaluation due to the presence of night pain, unexplained weight loss, and fatigue. Option D. Advise the athlete to rest from swimming for 2 weeks and then reassess without further immediate investigation, as rest is a common initial intervention for athletic injuries. Correct answer is B. Initiate a progressive strengthening program for the rotator cuff muscles and provide manual therapy for the supraspinatus, assuming the symptoms are a typical presentation of overuse injury. Explanation. This scenario is professionally challenging due to the inherent complexity of differential diagnosis in sports physical therapy, particularly when symptoms are vague or atypical. The physical therapist must navigate a landscape of potential pathologies, distinguishing between musculoskeletal injuries common in athletes and more serious, systemic conditions that could mimic sports-related complaints. The requirement to rule out serious conditions necessitates a high level of clinical reasoning and a thorough understanding of red flags, referral patterns, and the limitations of physical therapy intervention. Failure to accurately identify the source of symptoms or to recognize a serious underlying condition can lead to delayed diagnosis, inappropriate treatment, and potentially severe patient harm, with significant ethical and legal ramifications. The correct approach involves a systematic and comprehensive differential diagnosis process. This begins with a detailed subjective examination to gather information about the onset, nature, location, and aggravating/alleviating factors of the patient's symptoms. This is followed by a targeted objective examination, including observation, palpation, range of motion, strength testing, special tests, and neurological screening. Crucially, this process must include a deliberate screening for systemic conditions or red flags that fall outside the scope of physical therapy practice. When such red flags are identified, the physical therapist has a clear ethical and legal obligation to refer the patient to an appropriate medical professional for further evaluation and diagnosis. This aligns with the principles of patient safety, professional competence, and the established scope of practice for physical therapists, as outlined by the American Physical Therapy Association, APTA, Standards of Practice, and the laws governing physical therapy in the United States. An incorrect approach would be to solely focus on common sports-related injuries without adequately screening for more serious conditions. This failure to rule out serious pathologies represents a breach of the professional duty of care. It could lead to a misdiagnosis of a life-threatening condition, resulting in delayed medical intervention and potentially catastrophic outcomes for the patient. Ethically, this demonstrates a lack of diligence and a disregard for patient safety. Legally, it could constitute negligence. Another incorrect approach would be to prematurely attribute symptoms to a specific musculoskeletal injury based on limited evidence, without completing a thorough differential diagnosis. This overconfidence or haste in diagnosis can lead to treating the wrong condition, wasting valuable time and resources, and potentially exacerbating the underlying problem. This violates the principle of evidence-based practice and professional accountability. A third incorrect approach would be to continue with physical therapy interventions for symptoms that do not improve or worsen, despite a lack of clear diagnostic findings or the presence of red flags suggesting a non-musculoskeletal origin. This demonstrates a failure to recognize the limitations of physical therapy and a lack of appropriate clinical judgment regarding when to cease treatment and seek further medical consultation. This can lead to iatrogenic harm and a breach of professional responsibility. The professional decision-making process for similar situations should involve a structured approach. 1. Thorough subjective and objective examination. Gather comprehensive patient history and perform a detailed physical assessment. 2. Hypothesis generation. Develop a list of potential diagnoses based on the gathered information. 3. Differential diagnosis. Systematically evaluate each potential diagnosis by ruling in or ruling out possibilities through specific tests and clinical reasoning. 4. Red flag screening. Actively screen for signs and symptoms indicative of serious underlying pathology, e.g., cancer, infection, cardiovascular events, neurological emergencies. 5. Referral decision. If red flags are present or if symptoms are not improving as expected, or if the diagnosis is unclear and potentially outside the scope of physical therapy, make a timely and appropriate referral to a physician or other qualified healthcare provider. 6. Documentation. Meticulously document the entire process, including subjective findings, objective results, differential diagnoses considered, red flags identified, and any referrals made. Question 9. Assessment of an athlete recovering from a hamstring strain. An SCS is developing a plyometric progression plan. Which of the following approaches best balances the athlete's desire for a rapid return to sport with the principles of safe and effective plyometric training, considering the demands of their sport? Option A. Utilizing a standardized, generic plyometric program that has been successful for other athletes with similar injuries, regardless of individual differences or sport-specific requirements. Option B. Immediately initiating high-intensity, high-volume plyometric drills that mimic the athlete's sport to accelerate their return to full participation. Option C. Implementing a phased progression of plyometric exercises, starting with low-intensity, low-volume drills focusing on landing mechanics and gradually increasing intensity, volume, and complexity based on the athlete's objective functional capacity and sport-specific demands. Option D. Relying solely on the athlete's subjective report of feeling ready to progress to more advanced plyometric exercises without objective functional testing. The correct answer is C. Implementing a phased progression of plyometric exercises, starting with low-intensity, low-volume drills focusing on landing mechanics and gradually increasing intensity, volume, and complexity based on the athlete's objective functional capacity and sport-specific demands. Explanation. Assessment of a certified clinical specialist in sports physical therapy, SCS, requires a deep understanding of evidence-based practice and the ethical considerations inherent in athlete care. This scenario is professionally challenging because it demands the SCS to balance the athlete's desire for rapid return to play with the imperative to ensure long-term health and prevent re-injury, all within the scope of practice and established guidelines. The SCS must critically evaluate different plyometric progression strategies, considering not only the physiological demands, but also the athlete's individual response, psychological readiness, and the specific demands of their sport. The correct approach involves a systematic, individualized, and progressive increase in plyometric intensity, volume, and complexity, guided by objective measures of readiness and functional capacity. This aligns with the core principles of sports physical therapy, emphasizing a phased return to sport that prioritizes tissue healing, neuromuscular control, and sport-specific demands. Regulatory frameworks and professional guidelines for SCS credentialing implicitly endorse this approach by requiring adherence to ethical practice, evidence-based interventions, and patient-centered care. This means the SCS must continuously reassess the athlete's tolerance and progress, making adjustments as needed to mitigate risk. An incorrect approach would be to solely rely on a generic, predetermined plyometric program without considering the athlete's specific deficits or recovery status. This fails to meet the ethical obligation to provide individualized care and could lead to premature return to sport or re-injury, violating the principle of do no harm. Another incorrect approach would be to prioritize the athlete's subjective desire to return to play over objective clinical findings and establish safety protocols. This demonstrates a failure to exercise professional judgment and could expose the athlete to undue risk, contravening the SCS's responsibility to act in the athlete's best interest. Finally, implementing plyometric exercises that exceed the athlete's current capacity or are not appropriately progressed based on their sport's demands would be a direct violation of safe and effective training principles, potentially leading to injury and professional censure. Professional decision-making in such situations requires a systematic process. 1. Thorough assessment of the athlete's current functional status, including strength, power, proprioception, and sport-specific movement patterns. 2. Identification of any residual deficits or impairments. 3. Development of an individualized, progressive rehabilitation and training plan that addresses these deficits and gradually introduces plyometric demands. 4. Continuous monitoring of the athlete's response to training, utilizing objective criteria for progression. 5. Open communication with the athlete, coach, and other healthcare providers. 6. Adherence to established guidelines for return to play and plyometric training safety. Question 10. Upon reviewing the initial subjective and objective findings for a 65-year-old male presenting with bilateral lower extremity weakness and intermittent chest tightness, which of the following approaches to the system's review and risk assessment is most appropriate to ensure patient safety and guide subsequent physical therapy interventions? Option A. Focus on a thorough neuromuscular systems review, assessing reflexes, sensation, and motor control, as the primary complaint is weakness, and defer detailed cardiovascular/pulmonary and integumentary reviews until the neuromuscular deficits are better understood. Option B. Proceed with a general systems review, briefly inquiring about each system without in-depth assessment, and then focus on the gastrointestinal and genitourinary systems, as these are often overlooked and can contribute to generalized fatigue and weakness. Option C. Prioritize a detailed musculoskeletal examination of the lower extremities to address the reported weakness, while noting the chest tightness as a secondary concern to be addressed later if musculoskeletal interventions are ineffective. Option D. Immediately initiate a comprehensive cardiovascular and pulmonary systems review, including vital signs, auscultation, and assessment for signs of dyspnea or edema, to rule out emergent conditions that could explain the weakness and chest tightness. The correct answer is C. Prioritize a detailed musculoskeletal examination of the lower extremities to address the reported weakness, while noting the chest tightness as a secondary concern to be addressed later if musculoskeletal interventions are ineffective. Explanation: this scenario is professionally challenging because it requires the physical therapist to integrate information from multiple systems reviews to form a comprehensive risk assessment for a complex patient. The challenge lies in prioritizing which systems require immediate and thorough investigation to ensure patient safety and guide appropriate intervention, while also recognizing the interconnectedness of these systems. Careful judgment is required to avoid premature closure or overlooking critical signs and symptoms that could indicate a serious underlying condition. The correct approach involves a systematic and prioritized risk assessment that begins with identifying potential red flags across all relevant body systems. This approach is justified by the American Physical Therapy Association, APTA, Standards of Practice for Physical Therapy, which mandate that physical therapists conduct a comprehensive examination, including a systems review, to identify factors that may affect the patient's functional status and guide the plan of care. Specifically, The apta physical therapy scope of practice emphasizes the importance of screening for and referring to other healthcare professionals when findings fall outside the physical therapist's scope of practice. A thorough risk assessment, starting with identifying potential cardiovascular/pulmonary or neuromuscular red flags, aligns with the ethical obligation to protect patient well-being and practice within the bounds of professional competence. An incorrect approach that focuses solely on the musculoskeletal system without considering potential systemic implications fails to adhere to the apta standards of practice. This approach risks overlooking serious underlying conditions that may present with musculoskeletal pain but have a primary origin in another system, such as a cardiac issue presenting as referred pain. This constitutes a failure to perform a comprehensive examination and a potential breach of the ethical duty to act in the patient's best interest. Another incorrect approach that involves immediately initiating a specific treatment protocol without a thorough risk assessment is also professionally unacceptable. This bypasses the critical step of identifying potential contraindications or precautions related to the patient's overall health status, as mandated by the apta standards of practice. This could lead to exacerbating an undiagnosed condition or causing harm, violating the ethical principle of non-maleficence. A third incorrect approach that involves deferring all potential non-musculoskeletal findings to other disciplines without any initial screening or consideration of their impact on the patient's rehabilitation plan is also flawed. While referral is important, a physical therapist has a responsibility to perform an initial assessment of all relevant systems to determine the urgency and nature of potential referrals, and to understand how these findings might influence the physical therapy plan of care. This failure to conduct an adequate initial screening can delay appropriate diagnosis and treatment. The professional decision-making process for similar situations should involve a structured approach. 1. Initiate the examination with a broad overview, including a systems review, to identify any immediate red flags or potential life-threatening conditions. 2. Prioritize investigation of systems that present with the most concerning signs or symptoms, particularly cardiovascular/pulmonary and neuromuscular systems, due to their potential for rapid deterioration and systemic impact. 3. Integrate findings from all systems to develop a comprehensive understanding of the patient's health status and potential risks. 4. Formulate a differential diagnosis and risk assessment, determining which findings fall within the physical therapist's scope of practice and which require referral to other healthcare professionals. 5. Develop a safe and effective plan of care that addresses the patient's primary complaints while mitigating identified risks and coordinating with other members of the healthcare team. Question 11. Risk assessment procedures indicate that a collegiate soccer player presents with recurrent hamstring pain. Which of the following approaches to gathering a comprehensive history is most critical for establishing an effective and safe treatment plan, considering the athlete's specific context and potential contributing factors? Option A. Prioritizing detailed questioning about the athlete's current training regimen, including intensity, volume, and periodization, alongside a thorough exploration of the mechanism of each hamstring injury episode, previous injury history, and current medication use. Option B. Focusing primarily on the athlete's social history, including their academic pressures and sleep patterns, to understand their overall stress levels and their current activity level outside of soccer. Option C. Emphasizing the athlete's personal goals for the season and their perceived limitations due to the pain, while deferring detailed inquiry into the biomechanics of the injury and their training history. Option D. Concentrating on obtaining a complete list of all current and past medical conditions and a detailed record of all medications the athlete is currently taking, without extensively probing the specifics of the hamstring injuries. The correct answer is A. Prioritizing detailed questioning about the athlete's current training regimen, including intensity, volume, and periodization, alongside a thorough exploration of the mechanism of each hamstring injury episode, previous injury history, and current medication use. Explanation. The scenario presents a common challenge in sports physical therapy, a patient presenting with a complex injury history that could influence current management. The professional challenge lies in discerning which historical elements are most pertinent to the current presentation and ensuring that the comprehensive history taken is not only thorough, but also ethically and legally sound within the scope of practice defined by the Certified Clinical Specialist in Sports Physical Therapy, SCS. credentialing body, and relevant U.S. regulations governing physical therapy practice. This requires a systematic approach to information gathering and interpretation, prioritizing patient safety and effective treatment planning. The correct approach involves a systematic and comprehensive gathering of information across all specified domains: mechanism of injury, training regimen, previous injuries, medical history, medications, social history, activity level, and patient goals. This aligns with the ethical imperative to provide patient-centered care, which necessitates understanding the individual's unique context. Legally, a thorough history is fundamental to establishing a diagnosis, developing a treatment plan, and documenting the encounter, which are all requirements under state practice acts and potentially federal regulations like HIPAA concerning patient privacy and record keeping. The SCS credential signifies a commitment to advanced knowledge and skills, including the ability to integrate diverse historical data into clinical reasoning. An incorrect approach would be to focus solely on the mechanism of injury and previous injuries, neglecting other critical areas. This failure to gather a comprehensive history is ethically problematic, as it risks overlooking contributing factors to the current condition or potential contraindications to treatment. It could also lead to an incomplete understanding of the patient's functional limitations and goals, thereby compromising the quality of care. From a regulatory standpoint, such an incomplete assessment could be viewed as a deviation from the standard of care expected of a licensed physical therapist, potentially leading to professional disciplinary action. Another incorrect approach would be to prioritize gathering information about the patient's social history and activity level to the exclusion of the specific injury details and medical history. While social and activity information is important for context and goal setting, it is insufficient on its own to guide clinical decision-making for an acute or chronic injury. Ethically, this approach fails to adequately address the patient's immediate physical needs and potential underlying pathology. Regulatory concerns would arise from the failure to conduct a thorough physical assessment and gather relevant medical information, which is a core responsibility of physical therapy practice. A third incorrect approach would be to collect information on medications and medical history, but fail to adequately explore the mechanism of injury, training regimen, or patient goals. While understanding a patient's medical background and current medications is crucial for safety, it does not provide the necessary information to understand the biomechanics of the injury or the patient's functional aspirations. This incomplete history would hinder the development of a targeted and effective rehabilitation plan, potentially leading to suboptimal outcomes and failing to meet the patient's expectations. Ethically, this represents a failure to fully engage in the diagnostic and therapeutic process, and regulatory bodies would expect a more holistic approach to patient assessment. The professional decision-making process for similar situations should involve a structured approach to history taking, ensuring all key domains are addressed systematically. This includes active listening, open-ended questioning, and the ability to probe for relevant details. Professionals should continuously evaluate the information gathered, linking it to their clinical knowledge base and the specific demands of sports physical therapy. When in doubt about the relevance or significance of certain historical details, it is prudent to gather more information or consult with colleagues or other healthcare professionals. Adherence to the SCS standards of practice and relevant U.S. regulations provides a framework for ethical and competent patient care. Question 12. Performance analysis shows a collegiate swimmer presenting with insidious onset of right shoulder pain, particularly during the recovery phase of their freestyle stroke and when reaching overhead. The athlete reports a general feeling of stiffness and a perceived loss of strength. The physical therapist observes mild guarding during active elevation and external rotation. Considering the need for a comprehensive differential diagnosis, which of the following assessment strategies best guides the subsequent clinical reasoning and treatment planning for this athlete? Option A. Initiate a series of proprioceptive and neuromuscular control exercises to address the reported stiffness and perceived weakness. Option B. Conduct a thorough assessment of active, passive, and resisted range of motion for all planes of shoulder movement, specifically noting any limitations, pain reproduction, and the presence of a capsular pattern. Option C. Proceed directly to functional strength testing of the rotator cuff muscles to quantify deficits. Option D. Focus solely on palpation of the supraspinatus and deltoid muscles to identify areas of tenderness and trigger points. The correct answer is C. Proceed directly to functional strength testing of the rotator cuff muscles to quantify deficits. Explanation: this scenario is professionally challenging because it requires the physical therapist to integrate objective findings from ROM assessments with the patient's subjective experience and functional limitations, all while adhering to the established scope of practice and ethical guidelines for a certified clinical specialist in sports physical therapy, SCS. The therapist must accurately interpret the nuances of active, passive, and resisted ROM to differentiate between inert and contractile tissue involvement, and to identify potential capsular patterns, which are crucial for differential diagnosis and guiding treatment. The complexity arises from the need to avoid overinterpretation or misinterpretation of findings, which could lead to inappropriate interventions and potentially harm the patient or delay recovery. The correct approach involves a comprehensive assessment that systematically evaluates active, passive, and resisted ROM, paying close attention to the quality of movement, pain provocation, and the presence of any capsular patterns. This approach aligns with the fundamental principles of musculoskeletal assessment and is directly supported by the evidence-based practice expected of an SCS. Regulatory frameworks for physical therapy, including those governing SCS certification, emphasize the importance of accurate diagnosis and individualized treatment planning based on thorough patient evaluation. Ethical guidelines mandate that practitioners act in the best interest of the patient, which includes performing a complete and accurate assessment to ensure the most effective and safe care. Identifying a capsular pattern, for instance, provides critical diagnostic information that guides the selection of appropriate manual therapy techniques and therapeutic exercises, thereby optimizing patient outcomes and adhering to professional standards. An incorrect approach would be to solely rely on active ROM findings without proceeding to passive and resisted testing. This failure to conduct a complete ROM assessment would violate the principle of thorough evaluation, potentially leading to an incomplete or inaccurate diagnosis. Ethically, this could be considered negligence as it fails to explore all necessary diagnostic avenues. Another incorrect approach would be to assume a capsular pattern based on limited observations, such as only noting limited external rotation in the shoulder, without systematically testing all planes of motion and considering other potential causes of restriction. This premature conclusion bypasses the rigorous diagnostic process required and could lead to inappropriate treatment, potentially exacerbating the patient's condition or causing iatrogenic injury. Such an approach would contravene the SCS's responsibility to provide evidence-based and diagnostically sound care. Furthermore, focusing solely on pain during resisted ROM without considering the underlying biomechanics and potential tissue irritability would be an incomplete assessment, failing to differentiate between pain as a symptom and the source of the pathology. This could lead to ineffective treatment strategies and a failure to address the root cause of the patient's dysfunction, which is a breach of professional duty. Professional decision-making in such situations requires a systematic, evidence-based approach. The therapist should first gather subjective information, then proceed with objective assessments in a logical sequence, starting with active ROM, followed by passive ROM, and then resisted ROM. The identification of any limitations, pain, or aberrant movement during these tests should prompt further investigation, such as assessing for specific capsular patterns. This iterative process of assessment, interpretation, and refinement of the differential diagnosis ensures that interventions are targeted, effective, and safe, aligning with the highest standards of clinical practice and regulatory expectations for an SCS. Question 13. Implementation of a systematic visual assessment of a new patient presenting with a suspected ankle sprain, encompassing their standing posture, observed gait mechanics, presence and location of swelling, any visible deformities, existing scars, and the integrity of the skin, is most aligned with best practice for initial patient observation in sports physical therapy. Option A. Conducting a rapid visual scan to identify the most apparent injury signs before proceeding to palpation. Option B. Immediately interpreting observed postural deviations as indicative of a specific underlying pathology. Option C. Focusing solely on the degree of swelling around the ankle joint. Option D. Implementing a systematic visual assessment of the patient's posture, gait, swelling, deformities, scars, and skin integrity. The correct answer is D. Implementing a systematic visual assessment of the patient's posture, gait, swelling, deformities, scars, and skin integrity. Explanation: this scenario presents a common challenge in sports physical therapy: the need to accurately and comprehensively document initial observations of a patient presenting with a potential sports-related injury. The professional challenge lies in ensuring that the observation process is not only thorough, but also adheres to best practices for patient assessment and documentation, which are implicitly guided by the standards of practice expected for a certified clinical specialist in sports physical therapy, SCS. This requires a systematic approach that captures all relevant visual information without making premature diagnostic conclusions. The correct approach involves a systematic, objective, and comprehensive visual assessment of the patient's posture, gait, and any visible signs of injury such as swelling, deformities, scars, or skin integrity issues. This approach is considered best practice because it forms the foundational data for the subsequent physical examination and treatment plan. It aligns with the ethical imperative to provide competent and evidence-based care, ensuring that all observable findings are recorded accurately. While specific regulations for SCS certification might not explicitly detail every observational step, the overarching principles of professional conduct, patient safety, and accurate record-keeping, as expected within the physical therapy profession in the U.S., necessitate this thoroughness. An incorrect approach would be to focus solely on the most obvious sign of injury, such as swelling, while neglecting other observable factors like gait deviations or skin integrity. This is a failure because it leads to an incomplete picture of the patient's condition, potentially missing crucial information that could influence diagnosis or treatment. It also risks overlooking signs of secondary complications or pre-existing conditions. Another incorrect approach is to interpret the observed findings prematurely, for example, by immediately labeling a posture as poor without further assessment or considering the context of the injury. This demonstrates a lack of objectivity and can lead to biased clinical reasoning, deviating from the principle of gathering unbiased observational data. Finally, an approach that prioritizes speed over thoroughness, leading to a superficial observation, is also professionally unacceptable. This compromises the quality of the initial assessment and can result in misdiagnoses or ineffective treatment strategies, failing to meet the expected standard of care for a specialist. The professional decision-making process for similar situations should involve a commitment to a structured and comprehensive initial observation. This includes dedicating sufficient time to visually inspect the patient from multiple angles, considering the entire kinetic chain, and documenting all findings objectively. Professionals should constantly remind themselves of the importance of a holistic view, recognizing that seemingly minor observations can be significant. They should also practice self-awareness to avoid premature diagnostic labeling and focus on gathering raw data before interpretation. Adherence to established physical therapy assessment protocols and the ethical guidelines of the profession are paramount in ensuring that observational data is accurate, complete, and serves as a reliable basis for further clinical reasoning. Question 14. Which approach would be most appropriate for a sports physical therapist to recommend to an elite runner seeking to improve their 5K performance while simultaneously reducing their risk of hamstring strains, considering the interplay of stride length, stride rate, and ground contact time? Option A. An intervention aimed at drastically reducing ground contact time by implementing drills that emphasize rapid foot turnover, assuming this will lead to a more efficient and less injury-prone gait. Option B. A recommendation to adopt the biomechanical characteristics of a world record holder in the 5K, regardless of the individual athlete's current physical attributes or training history. Option C. Comprehensive biomechanical analysis to identify specific patterns in stride length, stride rate, and ground contact time that are suboptimal for performance and potentially contributing to injury risk, followed by a targeted, progressive intervention program addressing these identified patterns. Option D. A strategy focused on significantly increasing stride length through aggressive stretching and plyometric exercises, with the expectation that this will naturally improve running economy and reduce injury. Correct answer is C. A comprehensive biomechanical analysis to identify specific patterns in stride length, stride rate, and ground contact time that are suboptimal for performance and potentially contributing to injury risk, followed by a targeted, progressive intervention program addressing these identified patterns. Explanation: this scenario is professionally challenging because it requires a sports physical therapist to balance the athlete's desire for performance enhancement with the imperative to prevent injury, all within the scope of practice and ethical guidelines. The therapist must critically evaluate different methods of assessing and intervening in running biomechanics, ensuring that any recommendations are evidence-based, safe, and aligned with the athlete's specific goals and physical capabilities. The complexity arises from the interconnectedness of stride length, stride rate, and ground contact time, and how manipulating one can affect the others and the overall injury risk profile. Careful judgment is required to avoid oversimplification or the application of generic advice that may not be suitable for the individual athlete. The correct approach involves a comprehensive, individualized assessment that integrates objective biomechanical data with the athlete's subjective experience and performance goals. This approach prioritizes a thorough understanding of the athlete's current running pattern, identifying specific areas for potential improvement that are directly linked to both performance gains and injury reduction. It emphasizes a collaborative process with the athlete, educating them on the rationale behind any proposed interventions and ensuring their buy-in. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that interventions are intended to help and do no harm, and with the professional standards of practice that mandate individualized care based on thorough evaluation. An approach that focuses solely on maximizing stride length without considering its impact on stride rate and ground contact time is incorrect. This could lead to increased eccentric loading on muscles and tendons, potentially elevating the risk of overuse injuries such as stress fractures or tendinopathies, and may not necessarily improve performance if it compromises efficiency. This fails to uphold the principle of non-maleficence by potentially introducing harm. An approach that prioritizes reducing ground contact time at all costs, without considering the athlete's current capabilities or the potential for compensatory movements, is also incorrect. While shorter ground contact time can be associated with faster running, an abrupt or forced reduction could lead to increased impact forces or altered joint mechanics, again increasing injury risk. This approach neglects a holistic biomechanical assessment and could violate the principle of beneficence by not providing optimal care. An approach that relies solely on anecdotal evidence or popular running trends without a foundation in biomechanical principles and individual assessment is professionally unsound. This risks providing ineffective or even harmful advice, failing to meet the standard of care expected of a certified clinical specialist in sports physical therapy. It disregards the need for evidence-based practice and individualized treatment planning. The professional decision-making process for similar situations should involve a systematic evaluation. First, gathering comprehensive subjective and objective data about the athlete. Second, analyzing this data through the lens of established biomechanical principles and current research. Third, identifying specific, modifiable factors that influence performance and injury risk. Fourth, developing a personalized intervention plan in collaboration with the athlete. And fifth, continuously monitoring and re-evaluating the athlete's response to treatment, adjusting the plan as needed. This iterative process ensures that interventions are safe, effective, and tailored to the individual. Question 15. The analysis reveals that a collegiate soccer player presents with persistent anterior knee pain, exacerbated by running and jumping. During palpation, the physical therapist notes localized tenderness and a slight increase in skin temperature over the patellar tendon insertion. The therapist also elicits tenderness when palpating the medial femoral condyle, though the patient reports this as a dull ache rather than sharp pain. Which palpation approach best facilitates accurate differentiation of the primary source of pain and guides subsequent treatment planning within the scope of sports physical therapy practice? Option A. Palpating only superficial soft tissues and bony landmarks around the knee, disregarding deeper structures and the medial femoral condyle tenderness as potentially unrelated. Option B. Relying primarily on the increased skin temperature over the patellar tendon to confirm inflammation and initiating treatment based solely on this finding without further palpation or comparative assessment. Option C. Focusing palpation exclusively on the most tender spot over the patellar tendon insertion, assuming this is the primary source of pain due to its direct correlation with the patient's reported exacerbation with activity. Option D. Systematically palpating the entire anterior kinetic chain, comparing temperature and tenderness of soft tissues and bony landmarks bilaterally, and correlating findings with the patient's reported pain intensity and location. The correct answer is D. Systematically palpating the entire anterior kinetic chain, comparing temperature and tenderness of soft tissues and bony landmarks bilaterally, and correlating findings with the patient's reported pain intensity and location. Explanation. The scenario presents a common challenge in sports physical therapy, differentiating between localized soft tissue tenderness due to acute injury and that arising from chronic overuse or referred pain. A certified clinical specialist in sports physical therapy, SCS, must employ a systematic and evidence-based approach to palpation, integrating findings with the patient's history and functional assessment. The professional challenge lies in the subjective nature of palpation and the potential for misinterpretation, which can lead to incorrect diagnosis and treatment, impacting patient outcomes and potentially violating professional standards of care. Careful judgment is required to ensure accurate identification of the source of pain and dysfunction. The correct approach involves a systematic comparative palpation technique. This begins with identifying bony landmarks to orient the examiner. Then, superficial soft tissues are assessed for temperature and tenderness, noting any deviations from the contralateral side or expected norms. Deeper palpation then systematically assesses muscles, tendons, ligaments, and fascial structures in the region of complaint, as well as potential referred pain zones. This comparative approach, assessing both the symptomatic and asymptomatic sides, and systematically moving from superficial to deep, and proximal to distal, or vice versa, depending on the suspected pathology, allows for a more objective differentiation of tissue involvement and pain origin. This aligns with the American Physical Therapy Association, APTA, Standards of Practice and Code of Ethics, which mandate competent and ethical patient care, including accurate assessment and diagnosis based on thorough examination. The SCS credential signifies a commitment to advanced practice, which includes mastery of such foundational yet critical examination skills. An incorrect approach would be to solely focus on the most painful area without a systematic comparative assessment. This could lead to overlooking the primary source of the problem if the tenderness is secondary or referred. It also fails to establish a baseline for comparison, making it difficult to objectively track changes. Ethically, this is a failure to provide a comprehensive and competent examination, potentially leading to suboptimal care. Another incorrect approach would be to rely solely on temperature changes without correlating them with palpation tenderness and the patient's history. While increased temperature can indicate inflammation, it is not a definitive diagnostic tool on its own and must be interpreted in conjunction with other findings. Ignoring tenderness or the patient's subjective report of pain during palpation would be a significant ethical and professional failing, as it disregards crucial patient-reported information essential for accurate diagnosis. A third incorrect approach would be to palpate only superficial structures and neglect deeper tissues or bony landmarks. This would result in an incomplete assessment, potentially missing significant pathology within deeper muscles, tendons, ligaments, or even stress fractures. This demonstrates a lack of thoroughness and adherence to best practices in physical examination, which is a core tenet of professional responsibility. The professional reasoning process for similar situations should involve a structured approach. 1. Thoroughly review the patient's history, including mechanism of injury, onset, duration, and aggravating/alleviating factors. 2. Perform a systematic visual inspection. 3. Initiate palpation with a comparative approach, assessing bony landmarks, temperature, and superficial tissues on both symptomatic and asymptomatic sides. 4. Progress to systematic palpation of deeper soft tissues, muscles, tendons, ligaments, fascia, in the affected region and potential referred pain areas, consistently comparing findings bilaterally. 5. Correlate palpation findings with the patient's subjective reports of pain and functional limitations. 6. Integrate all findings to formulate a differential diagnosis and guide further assessment and treatment planning. 7. Continuously reevaluate and refine the diagnosis based on the patient's response to intervention. Question 16. Strategic planning requires a sports physical therapist to consider the most effective and ethically sound initial management of an acute athletic injury. Given the potential for a significant musculoskeletal injury, which of the following represents the most appropriate initial course of action to ensure patient safety and optimize outcomes according to U.S. regulatory frameworks for physical therapy practice? Option A. Focus solely on ice and compression to rapidly reduce swelling, deferring further assessment until the athlete is more comfortable. Option B. Immediately apply the full price protocol protection, rest, ice, compression, elevation, to mitigate inflammation and pain. Option C. Conduct a comprehensive subjective and objective physical examination to inform the subsequent application of price components. Option D. Administer pain medication, and then proceed with the price protocol as reported by the athlete. The correct answer is B. Immediately apply the full price protocol protection, rest, ice, compression, elevation, to mitigate inflammation and pain. Explanation. This scenario presents a common implementation challenge for the price protocol in sports physical therapy, particularly within the context of the Certified Clinical Specialist in Sports Physical Therapy, SCS, certification's regulatory framework, which emphasizes evidence-based practice and patient-centered care within the United States. The challenge lies in balancing the immediate application of price with the need for a comprehensive initial assessment, especially when faced with a potentially serious injury, and the pressure to do something immediately. A sports physical therapist must exercise sound clinical judgment to avoid premature interventions that could mask underlying pathology or delay definitive diagnosis and treatment. The correct approach involves a thorough initial assessment to guide the application of price. This means the therapist must first gather subjective and objective information to understand the nature and extent of the injury. This assessment informs the decision-making process regarding which components of price are most appropriate and in what sequence. For instance, if a fracture is suspected, aggressive compression might be contraindicated. This approach aligns with the SCS credential's emphasis on advanced clinical reasoning and the legal and ethical obligations of physical therapists in the U.S. to provide safe and effective care, which begins with accurate diagnosis and assessment before intervention. An incorrect approach would be to immediately apply all components of price without a preceding assessment. This could lead to several regulatory and ethical failures. Firstly, it violates the principle of patient-centered care by not tailoring the intervention to the individual's specific condition. Secondly, it risks delaying the identification of more serious injuries, potentially leading to adverse outcomes and violating the duty of care. Furthermore, it may not align with the evidence-based practice standards expected of an SCS specialist, as the efficacy of price is context-dependent and requires clinical justification. Another incorrect approach would be to solely rely on the athlete's or coach's report of the injury to dictate the price intervention. While subjective information is crucial, it is not a substitute for objective clinical examination. This approach could lead to misdiagnosis and inappropriate treatment, potentially causing harm and falling short of the professional standards required for SCS certification and the practice of physical therapy in the U.S. The professional decision-making process for similar situations should involve a systematic approach. 1. Prioritize patient safety and rule out red flags. 2. Conduct a thorough subjective and objective examination to establish a working diagnosis. 3. Based on the assessment, determine the most appropriate and evidence-based interventions, including the judicious application of price components. 4. Continuously reevaluate the patient's response to treatment and adjust the plan accordingly. This process ensures that interventions are not only timely, but also safe, effective, and ethically sound, reflecting the advanced competencies of an SCS specialist. Question 17. Stakeholder feedback indicates that a high school athlete, cleared by their physician for return to sport after a significant ankle sprain, expresses strong desire to play in an upcoming championship game, despite the physical therapist's assessment revealing residual deficits in proprioception and strength, and the athlete reporting psychological apprehension about re-injury. The athlete's parents are also concerned about the potential for re-injury, but are hesitant to overrule their child's wishes. What is the most ethically and professionally appropriate course of action for the Certified Clinical Specialist in Sports Physical Therapy, SCS? Option A. Inform the athlete and parents that return to play is not recommended at this time and mandate further rehabilitation without further discussion or input from the physician. Option B. Facilitate a collaborative discussion involving the athlete, parents/guardians, and the referring physician to review the athlete's current status, discuss the risks and benefits of immediate return to play versus continued rehabilitation, and jointly determine the safest and most appropriate path forward. Option C. Allow the athlete to return to play immediately, prioritizing their expressed desire and the physician's initial clearance, with the understanding that the athlete assumes all risks. Option D. Advise the athlete to play through the apprehension and deficits, assuring them that they are likely to toughen up and that the championship is a critical opportunity. The correct answer is B. Facilitate a collaborative discussion involving the athlete, parents/guardians, and the referring physician to review the athlete's current status, discuss the risks and benefits of immediate return to play versus continued rehabilitation, and jointly determine the safest and most appropriate path forward. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the physical therapist's clinical judgment regarding their readiness for return to sport. The physical therapist must navigate this ethical tightrope, balancing patient autonomy with the responsibility to prevent re-injury and ensure safe participation. The Certified Clinical Specialist in Sports Physical Therapy, SCS, designation implies a higher level of expertise and ethical accountability, demanding a rigorous decision-making process grounded in evidence and professional standards. The correct approach involves a collaborative discussion with the athlete, their parents/guardians if applicable and legally required, and the referring physician. This approach prioritizes open communication, shared decision-making, and a comprehensive assessment of the athlete's physical and psychological readiness. It aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy. Specifically, it adheres to the American Physical Therapy Association, APTA, Code of Ethics, which emphasizes the physical therapist's duty to provide competent care, respect patient rights, and collaborate with other healthcare professionals. The SCS credential signifies a commitment to these principles and the ability to apply them in complex sports-related situations. An incorrect approach would be to solely defer to the athlete's desire to return to play without a thorough clinical evaluation and discussion of risks. This disregards the physical therapist's professional responsibility to ensure the athlete is physically prepared and may lead to re-injury, violating the principle of non-maleficence and potentially breaching professional standards of care. Another incorrect approach would be to unilaterally deny return to play based solely on the physical therapist's opinion, without engaging in a dialogue with the athlete and other stakeholders. While the therapist has a duty to protect the athlete, this approach undermines patient autonomy and the collaborative nature of healthcare. Finally, an approach that involves pressuring the athlete to accept the therapist's decision without exploring their concerns or providing adequate rationale would also be ethically unsound, failing to uphold respect for autonomy and potentially damaging the therapeutic relationship. Professional decision-making in such situations requires a systematic process. 1. Identify the ethical conflict. 2. Gather all relevant information, clinical findings, athlete's perspective, parental concerns, physician's input. 3. Consult relevant professional guidelines and ethical codes, e.g., APTA Code of Ethics. 4. Explore all available options and their potential consequences. 5. Engage in open and honest communication with all stakeholders. 6. Make a reasoned decision that prioritizes the athlete's well-being, while respecting their autonomy and involving them in the process. Question 18. Compliance review shows a certified clinical specialist in sports physical therapy is evaluating a competitive swimmer experiencing a plateau in performance and recurring mild shoulder discomfort during their freestyle stroke. The specialist has observed the swimmer's technique during practice sessions. Which of the following approaches best aligns with the professional and ethical obligations of an SCS in this situation? Option A. Prioritize the coach's suggestion to modify the stroke based on visual cues, even if it contradicts the specialist's initial biomechanical observations. Option B. Conduct a detailed biomechanical analysis of the swimmer's freestyle stroke to identify specific inefficiencies contributing to both reduced propulsion and potential injury risk, and then develop targeted interventions based on these findings. Option C. Implement a generic set of shoulder strengthening exercises recommended for swimmers without a specific assessment of the swimmer's individual biomechanical faults. Option D. Advise the swimmer to increase their training volume and intensity to overcome the performance plateau, assuming the discomfort is a normal consequence of increased effort. Correct answer is B. Conduct a detailed biomechanical analysis of the swimmer's freestyle stroke to identify specific inefficiencies contributing to both reduced propulsion and potential injury risk, and then develop targeted interventions based on these findings. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified clinical specialist in sports physical therapy, SCS, by requiring them to apply their specialized knowledge of swimming biomechanics to a real-world athlete's performance and injury risk. The challenge lies in balancing the athlete's desire for improved performance with the imperative of injury prevention, all while adhering to the ethical and professional standards governing physical therapy practice within the United States. The SCS must critically evaluate the athlete's current technique, identify potential biomechanical inefficiencies that could lead to injury, and formulate evidence-based interventions. This requires a deep understanding of the nuances of swimming strokes, the forces involved, and the physiological demands placed on the athlete's body. The decision-making process is complex because it involves interpreting subjective observations, objective biomechanical data, even if not explicitly numerical in this question, and the athlete's subjective experience, all within the scope of practice defined by the American Physical Therapy Association, APTA, and relevant state licensure laws. Correct approach analysis. The correct approach involves a systematic, evidence-based evaluation of the swimmer's stroke mechanics, focusing on identifying deviations from optimal biomechanical patterns that contribute to both reduced propulsion and increased injury risk. This approach prioritizes a comprehensive assessment that considers the kinetic chain, joint angles, muscle activation patterns, and the overall efficiency of the stroke. The SCS would then use this analysis to develop targeted interventions, such as specific drills, strengthening exercises, or flexibility programs, designed to correct biomechanical faults, enhance propulsive forces, and mitigate the risk of common swimming-related injuries like shoulder impingement or low back pain. This aligns with the APTA Code of Ethics, which emphasizes the physical therapist's responsibility to provide competent care based on current professional knowledge and evidence. It also adheres to the principles of evidence-based practice, a cornerstone of modern physical therapy, ensuring interventions are both effective and safe. Incorrect approach is analysis. An approach that solely focuses on increasing the swimmer's power output without a thorough biomechanical analysis is ethically and professionally flawed. This neglects the fundamental principle of injury prevention, potentially exacerbating existing biomechanical issues or creating new ones by overloading compromised tissues. Such an approach could violate the APTA Code of Ethics regarding the duty to protect patients from harm and the responsibility to provide care that is in the patient's best interest. Another incorrect approach would be to implement generic, unverified training modifications without a specific biomechanical rationale tied to the swimmer's observed technique. This lacks the specificity required for effective sports physical therapy and could be ineffective or even detrimental. It fails to meet the standard of care expected of a clinical specialist and could be considered a breach of professional responsibility, as it does not demonstrate due diligence in assessing and addressing the athlete's unique needs. Finally, an approach that prioritizes the coach's subjective opinions over a biomechanical assessment and the athlete's physical well-being is problematic. While collaboration with coaches is important, the physical therapist's primary ethical obligation is to the athlete's health and safety. Overriding biomechanical findings or ignoring potential injury risks based solely on a coach's preference would be a failure to uphold professional autonomy and the patient's right to informed care. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the athlete's current biomechanics, integrating subjective reports of pain or discomfort with objective observations of their stroke. This assessment should be guided by established principles of sports biomechanics and sports physical therapy. Following the assessment, the professional must synthesize this information to identify specific biomechanical inefficiencies and their potential contribution to both performance limitations and injury risk. Interventions should then be developed based on this analysis, prioritizing evidence-based strategies that address the identified issues. Throughout this process, open communication with the athlete and, when appropriate, their coach is crucial, ensuring shared understanding and collaborative goal setting. The professional must always maintain an ethical compass, prioritizing the athlete's well-being and adhering to the standards of practice set forth by professional organizations and regulatory bodies. Question 19. Process analysis reveals that a collegiate basketball player presents with recurrent patellofemoral pain during jumping and landing activities. Biomechanical analysis of their jumping and landing mechanics reveals significant eccentric quadriceps loading and increased knee abduction moments during the landing phase. Considering the regulatory framework for certified clinical specialists in sports physical therapy, SCS, in the U.S., which of the following approaches best reflects the appropriate application of this joint kinetics data for clinical decision-making? Option A. Recommend a comprehensive program of eccentric quadriceps strengthening, neuromuscular re-education focusing on hip abduction control, and plyometric training modifications to reduce peak ground reaction forces during landing. Option B. Advise the athlete to immediately change their footwear to a brand known for superior shock absorption, without further assessment of their gait or foot mechanics. Option C. Suggest the athlete consult with a sports psychologist to address potential psychological factors contributing to their landing mechanics. Option D. Inform the athlete that the data indicates a high risk of immediate ACL rupture and advise them to cease all athletic activity indefinitely. The correct answer is A. Recommend a comprehensive program of eccentric quadriceps strengthening, neuromuscular re-education focusing on hip abduction control, and plyometric training modifications to reduce peak ground reaction forces during landing. Explanation. This scenario presents a professional challenge because it requires a sports physical therapist to interpret complex biomechanical data, joint kinetics, and translate it into actionable clinical interventions, all while adhering to the specific regulatory and ethical standards governing the Certified Clinical Specialist in Sports Physical Therapy, SCS, credential. The core of the challenge lies in ensuring that the interpretation and application of joint kinetics data are not only clinically sound, but also align with the scope of practice and professional responsibilities defined by the SCS credentialing body and relevant U.S. Physical Therapy Practice Acts. The therapist must avoid overstepping boundaries or making unsubstantiated claims based on the data. The correct approach involves a comprehensive analysis of the joint kinetics data within the context of the athlete's specific sport, movement patterns, and injury history. This approach prioritizes understanding the forces acting on the joints during movement, the role of muscle forces in generating and controlling these movements, and the influence of ground reaction forces. The therapist then uses this understanding to identify potential contributing factors to the athlete's current condition or risk of injury. Crucially, this approach emphasizes the application of evidence-based interventions that directly address the biomechanical findings, such as targeted strengthening, neuromuscular re-education, or modification of movement strategies. This aligns with the SCS credentials focus on advanced clinical reasoning and evidence-based practice in sports physical therapy, as well as the general ethical obligations of physical therapists to provide competent and individualized care within their scope of practice, as outlined by the American Physical Therapy Association, APTA, Code of Ethics and State Practice Acts. An incorrect approach would be to solely focus on the raw numerical output of the joint kinetics analysis without considering the broader clinical picture. This might involve making definitive diagnoses or prognoses based solely on deviations from normative data, without integrating subjective patient information, functional limitations, or the specific demands of the athlete's sport. Such an approach fails to meet the standard of comprehensive patient assessment and can lead to inappropriate treatment plans. Ethically, this could be considered a failure to provide individualized care and a potential violation of the principle of beneficence, as it might lead to ineffective or even harmful interventions. Another incorrect approach would be to recommend interventions that fall outside the scope of physical therapy practice, based on the interpretation of the kinetics data. For example, suggesting significant changes to an athlete's equipment or training regimen that are typically managed by coaches or sports scientists, without proper collaboration or justification within the physical therapy scope. This could be seen as practicing outside one's expertise and potentially interfering with other healthcare professionals' roles, violating ethical guidelines regarding professional boundaries and interprofessional collaboration. A further incorrect approach would be to present the joint kinetics data to the athlete or other stakeholders in a way that is overly technical, alarmist, or lacks clear clinical relevance. This can lead to patient anxiety, misunderstanding, and a lack of adherence to the recommended treatment plan. Professional communication, especially when dealing with complex data, is a critical ethical and practical requirement. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly understand the athlete's presentation. Gather subjective information, history, symptoms, goals, and objective findings, physical examination, functional assessments. 2. Integrate biomechanical data. Analyze joint kinetics data in the context of the athlete's sport, movement demands, and clinical presentation. Identify how the forces and muscle actions might be contributing to the athlete's issues. 3. Formulate a differential diagnosis and identify impairments. Based on all available information, determine the most likely causes of the athlete's problems and the specific impairments, e.g., muscle weakness, poor motor control, joint instability. 4. Develop an evidence-based treatment plan. Design interventions that directly address the identified impairments and are supported by current scientific literature and best practices in sports physical therapy. 5. Communicate effectively. Clearly explain findings, rationale for treatment, and expected outcomes to the athlete and relevant stakeholders in an understandable manner. 6. Continuously reassess and modify. Monitor the athlete's progress and adjust the treatment plan as needed, re-evaluating the role of joint kinetics and other factors. 7. Adhere to scope of practice and ethical guidelines. Ensure all interventions and recommendations are within the legal and ethical boundaries of physical therapy practice and the SCS credential. Question 20. Consider a scenario where a sports physical therapist is evaluating a collegiate swimmer experiencing shoulder pain during the propulsive phase of the freestyle stroke. The therapist observes the action of the deltoid muscle lifting the humerus against the resistance of the water's drag and the weight of the arm. Based on the anatomical arrangement of the shoulder joint fulcrum, the deltoid muscle's insertion effort, and the resistance encountered during the stroke, which lever system is primarily at play, and how would understanding this classification inform the therapist's approach to rehabilitation and performance enhancement? Option A. The scenario primarily involves a third-class lever, where the resistance is located between the fulcrum and the effort. Understanding this would guide the therapist to focus on improving the mechanical advantage of the limb and reducing the overall load on the joint through techniques that promote better body positioning and reduce drag. Option B. The scenario primarily involves a second-class lever, where the resistance is located between the fulcrum and the effort. Understanding this would prompt the therapist to focus on improving the mechanical advantage of the limb and reducing the overall load on the joint through techniques that promote better body positioning and reduce drag. Option C. The scenario primarily involves a first-class lever, where the fulcrum is located between the effort and the resistance. Understanding this would lead the therapist to focus on improving the stability of the shoulder joint and the range of motion through exercises that emphasize joint mobilization and eccentric strengthening. Option D. The scenario primarily involves a third-class lever, where the effort is located between the fulcrum and the resistance. Understanding this would guide the therapist to focus on improving the efficiency of muscle contraction and potentially enhancing the swimmer's muscular endurance and power output through targeted strengthening and plyometric exercises. The correct answer is D. The scenario primarily involves a third-class lever, where the effort is located between the fulcrum and the resistance. Understanding this would guide the therapist to focus on improving the efficiency of muscle contraction and potentially enhancing the swimmer's muscular endurance and power output through targeted strengthening and plyometric exercises. Explanation: this scenario is professionally challenging because it requires a sports physical therapist to apply fundamental biomechanical principles to a clinical situation involving a patient's functional limitations. The challenge lies in accurately identifying the lever system at play, and then translating that understanding into an effective and safe treatment plan, all while adhering to the scope of practice and ethical guidelines. For a certified clinical specialist in sports physical therapy, SCS, the therapist must demonstrate not only theoretical knowledge, but also the ability to integrate this knowledge into patient care, ensuring interventions are evidence-based and patient-centered. The correct approach involves accurately identifying the class of lever based on the relative positions of the fulcrum, the effort force applied by the muscle, and the resistance, body part weight or external load. This accurate identification then informs the selection of appropriate therapeutic exercises and manual techniques that either enhance or counteract the biomechanical advantage or disadvantage presented by that lever system. For example, Understanding a third-class lever, common in the human body, highlights the need for muscles to generate greater force to overcome resistance, which can guide exercise prescription to focus on strength and endurance. This approach is ethically justified, as it aligns with the SCS credential's emphasis on advanced clinical reasoning and evidence-based practice, ensuring patient safety and optimal outcomes by applying precise biomechanical understanding to treatment. An incorrect approach would be to misidentify the lever class. For instance, incorrectly classifying a second-class lever as a first-class lever could lead to the prescription of exercises or manual techniques that are biomechanically inappropriate, potentially increasing the risk of injury or hindering rehabilitation progress. This represents a failure in clinical reasoning and a deviation from evidence-based practice, which are core ethical responsibilities for an SCS. Another incorrect approach would be to identify the lever class correctly, but then fail to integrate this understanding into the treatment plan, treating it as a purely academic exercise without clinical application. This demonstrates a lack of clinical integration and a failure to leverage biomechanical knowledge for patient benefit, which is a breach of professional duty to provide comprehensive and effective care. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the patient's movement and the forces involved in the specific activity or deficit. Second, apply knowledge of biomechanics to identify the anatomical structures acting as the fulcrum, effort, and resistance. Third, accurately classify the lever system based on these components. Fourth, consider how this lever system influences the patient's functional limitations and potential for improvement. Finally, develop a treatment plan that specifically addresses the biomechanical characteristics of the identified lever system, aiming to optimize muscle activation, joint mechanics, and overall functional performance while prioritizing patient safety and adhering to the highest standards of professional practice.